Hello, everybody, and it's Teepa Snow again, and I have a guest here. Ooh, and here's what I'm going to tell you. We might all need to move to Tyler, Texas for really excellent, supportive medical care.
Thank you so much, Teepa. So I'm Dr. Khushbu Verma. I am currently located in the University of Texas at Tyler, and we just started our dementia center back in August of 2025. And it's really exciting to come to East Texas and serve an area which was previously we did not have a dementia specialist for years and years.
Mm-mm. No, I know that because I've been to Tyler, Texas, and they always talked about wanting to do more, and they worked hard to do more. I mean, me going down to Tyler, Texas was evidence that you have a strong core supportive community that cares a lot about brain fitness, brain health, body fitness, body health, and how are we going to take care of our community. And they brought you in.
Yeah, absolutely. I mean, Tyler is so giving. And when I first came here to interview, they said that if people of Tyler decide that they want something, they will make it happen. It has been so giving. People have been so kind, so welcoming, and the dementia care is so needed in this area. And it is the big reason, I was previously in Stanford, and that's where I had done my training. And while I was interviewing across the country, I chose Tyler, Texas, from all the places. I mean, I
Well,
have
it was
trained in
warm. Was that it? It was because it was warm? No.
warm both ways. It's warm and sunny
Ah,
weather, and the southern warm hospitality. Once you see it, you will not go anywhere in the country.
we have it in Hillsborough. I'm not headhunting, as they say. I so admire what you are doing. So tell us a little bit about what it is you do and how you're doing the dementia clinic, the dementia program, because you've you've made some requirements that are unusual requirements for practice these days.
Yes, Tipa, that kind of comes from the story that I myself have been in the shoes of caregiver. And once you go through that journey, it changes you forever and ever. So my grandmother had Alzheimer's disease. We got to see a geriatric psychiatrist back in India. We got 15 minutes with them. And in that 15 minutes, we were told she has dementia. She needs to be on these memory pills, antipsychotics, and also pills for Parkinson's. And that's it. The visit was done at that time. She was having falls. She was having swallowing difficulties. She was having confusion and hallucinations with UTI. So as a family, I come from a family of 50 doctors. So there are so many doctors in the family itself, and I tell that not to brag, but to tell that
No.
doctors themselves, it's not a topic that's taught so much in medical school. Dementia is not, I mean, I remember in my medical school, truly, I had a paragraph about dementia. So that's how much it is taught. And so when we, as a family of doctors, struggled, and I was doing my child neurology training at that time. So I'm a child neurologist, essentially by training. And that training, truly, I was in Austin, Texas. That's why I knew the Southern hospitality here. So
Mm.
I was doing that training, and it just kind of changed something in me. I said, if I cannot help the lady who raised me, what is the worth of doing any work here? So at that time, I switched my training to going into dementia care, and I completed my, of course, child neurology training and went into dementia care. But the whole idea of dementia is a whole body problem, and it's not just a brain problem. And the idea that it's not affecting that person that's in front of you, it's affecting the whole family. That kind of was an experience, and it's so difficult to even put in words or explain. So when I decided that I will do this, the first thing I thought of was my visits should be longer. So I started with 2-hour visits and 120 minutes with the families. And over time, I came to about 90 minutes, 1.5 hour. So this is the length of visits that I spend with my families, about 1.5 to 2 hours. And it's not that we need
By the
that.
way, this she's telling truth. I know, like, what? You have a doctor that does this and has this story and that believes as we believe, as people who watch this believe, it's like, wow, she's
Yes.
speaking truth. How
Yes,
exciting.
it is. It is something that I say, if you haven't gone through that experience yourself, it's so hard to understand. I mean, even other neurologists and other fields of neurology will say, why do you need so much time? What are you doing? And I tell them it's not that I'm taking this time to diagnose, because I can diagnose sometimes
That can
even
happen pretty
before.
quick.
Yeah.
After you've done this for a while, your brain goes, okay, so I see this, I see that, I don't see that. Okay, let me ask you a couple more. Yeah, pretty much. Here's
Yeah.
the history. I talked to the family. Oh, okay, we know where we're at now.
Now, and that's where, I think we have had the same kind of thought process, that it's not diagnose and adios. So again, diagnosis, sometimes I know even before I go into the room, I have their brain pictures, I have their reports, I know that I'm walking into this
Yeah,
diagnosis. But it's the time spent with saying that, what does dementia mean? What does
you got it.
mild cognitive impairment mean? What do these terms even mean? And where are we? And how will we move out, or how will we progress?
Yeah.
And then the time spent with every single symptom. So if we are falling, okay, what is the approach? How do we address that? If we have swallowing issues, so that it's again looking at it not just as a memory problem, but a full body problem. And a part of my visit also looks at the caregiver. So oftentimes I will talk to especially the men caregiver, because I feel
Mm,
like they are very likely
mm.
to be the man of the family and keep doing everything by themselves.
Here's the program I've put together for her, but she just won't get up and do it.
Yes, and oh my God, the apathy. So, kind of going over that this is a
Yep.
symptom of dementia. And I say, okay, what
She's
are the
not being
symptoms?
stubborn.
She's not doing it willfully. The get up and go, or the initiative, is now gone with
Yeah.
dementia. So a lot of times just kind of talking through and explaining the symptoms and how do we approach helps family get on the same page. And they see a lot of things like lightheadedness when I stand up. Oh, is it a part of my Lewy body? Okay, makes sense.
Yeah.
Constipation. So all that, when they tie together, it kind of is a light bulb that goes off, and they say,
You
oh,
got it. Yeah.
I got it. And it's the same thing, mild cognitive impairment. What is it? What is dementia? And trying to also remove the stigma behind the diagnosis. So every single time I say the word dementia, I say, this is not something about your intelligence, about how beautiful of a person you are, how loving you are. All it means is you need a little bit more help, and that's where we put a full stop. So in these conversations, families have told me, I have had an 80-year-old gentleman who walked up to me and said, I've never had a doctor who spends so much time. So
I
they
would agree
they
with this. I would agree. This
yeah.
is a very unique care approach. And yet, I truly believe personally that until we have more physicians that are willing to take this care approach, classically, they generate more issues that typically who's somebody out in the field working with families, are having to go, you might want to ask him about that medication because, she's on three and you started having falls when he added the third one. And tell me a little bit about why you asked for the third one again.
Mm-hmm.
It's sort of like I'm doing the thing that could and should be done, but here's a quick fix because I
Mm-hmm.
don't have anything to offer in dementia, is
Mm-hmm.
what I hear a lot from physicians.
Mm-hmm.
How do
And
we how do we change? You've done it. You've made the change. You are on the bus for let's do well by people because they're people first and they have families and let's do well by the family. Let's not let a family fall apart because of this. Let's not lose multiple people in the family over this. Let's not lose a family. Um, how do we get more physicians or providers interested in this sort of practice or supporting something that looks beyond the dementia?
A part of the problem is systemic. So
Um,
our schedules are driven by administration.
You've got to
And
have this. You have to
yes,
have these many tests. You got to go do this stuff.
yes.
So how are you doing that then?
So that's where I actually went to the community. I went to the donors and I said, what do you want?
Yeah,
What was your experience? Because
grassroots up.
and they said, you know what, we want longer comprehensive visits because for our family, that's what we really thought made a difference when they went to bigger centers across the country. And then I
Mm,
talked within our neurology family and department, and I said, dementia is not something that will make money. So at least can we give good care? We can find money in other parts of
yep.
medicine and neurology. This is a service that is meant to be a service to community. And as giving is a place Tyler is, I was
Yeah.
given that time. So it is just by the love of community that when I said that this is the reason we need that time, they said, yes, we understand. I mean, it's just admitting that it will not make money. So why do it poorly? Why not do it good
Look
and
at
look at
that.
Mhm.
Wow. Truth to power. And you did it. And you found support for that by really acknowledging this is a community condition, not just a single person condition, not just a single family condition. I mean, in general, I assume Tyler has significant numbers of older adults and adults that have risk factors for developing a younger dementia, even. You don't have to be old to have dementia. I mean, that's the other reality.
Mhm.
Um, that we will have young onset and it will be around in the community. And so not everybody's going to be 80 years old. I mean, we will have lots of people who are in the older categories. But if we can approach this way, we're much more likely to have fewer issues as things evolve over time. And
Yes.
people's lives are more likely to go in a direction that's reasonable than a direction that's horrendous multiple times.
Yes, and one thing that I wanted to add, Teepa, was that I've been involved nationally with writing white papers about what dementia care should look like.
Yep.
And the dementia specialists I've met, most of them are very special people because, when I made the decision from being a child neurologist to
Yep.
go to
Yep.
dementia, you can imagine what kind of things I heard. People
I
said,
can imagine the other 50 doctors in your family were like, you're going to what? No, you're a star. No, 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 no,
no,
no, no.
no, yeah, they all said, it's depressing. Why are you going there? You'll be depressed all day. And so, most of my colleagues actually that I meet out in the field, they all want to give more time. And it is the
They do. Yeah.
systems that they are working with that there is not a lot of time. So what we are working on right now is we are writing these white papers describing what should be the standard of care in dementia, why do we need the time, and how can we think about alternative ways to bill these visits because it's all comes to billing for the hospital administration. So currently, we the best way to kind of support that is we say time-based billing because this is the amount of or currency in my visit time I'm spending
Fine.
2 hours. So
Yep.
can I not say that a trained neurologist spends 2 hours with a family that's worth the reimbursement to the institution? So working on the structural level takes longer, but we are working on that as well.
Woo! Wow, both ends of the system. Good job. Well, I want to say congratulations and thank you. And kudos for all the choices that you've made to radically change this culture because we just have to, or we're going to have to figure out something that supports people through this a little differently because, what's happening otherwise is just not something we would want for somebody we care about or ourselves. So figuring that out, boy, thank you, thank you, thank you. And it's super exciting to hear this in
Yeah,
a
I
younger person.
I just, if I tell you the truth, I mean, I just look up to the sky and I pray that my grandmother forgives me. I couldn't take care of her. And I'm taking care of a lot of other grandparents, and through I hope it reaches to her, and that's
Oh,
the
it's legacy
part.
work for sure. I mean, for sure. And I have a lot to ask my grandma for forgiveness too, because my grandma also had Alzheimer's.
Yeah,
And
yeah.
I did not. I made some mistakes back then. It was a long time ago and didn't know any better. I do
I
now.
Yeah, I did too, and I think that brings a little bit of understanding in my patient consultation. So, I kept telling her, "I told you so." And now, when my family members do it, I tell them that I know you are doing it with a very good and pure heart, but it's hurting your loved one, and there are better approaches. So, having done that, the response that comes from me is not very paternalistic. It's more like, I know what you're feeling,
I've
and
been done that and it didn't work. So how did it work for you? Because it
yeah.
surely did not work well for my grandma and me.
Yeah, yeah.
Yeah.
And I think then they see me as a person, oh, okay, she has struggled and she's made
You've done the
same
care.
same approach that I'm doing, but so she can also make that mistake. So it's humanizes the experience a little bit more than
Yay.
say if I had done something where I've not gone through it. So it's different.
Yeah, it is. Well, we are super excited to hear that Tyler has a specialty practice. And not only that, they have a special physician running the specialty practice with a team. And you have an amazing team that you're working with as well. And you also know Don Kent, who's a really good friend of ours. So we feel like we're connected. At one of these points we'll have to come and you like make a connection for sure. But
I mean, I would love to have you and sit together with Don Kent and three of us. And my team absolutely, absolutely
a lot of fun.
loves you. And we watch your videos and learn so much. So,
Yay.
yeah.
Well, everybody out there,
Mhm.
courage. It's really important, but so is finding the right person who steps forward and fills a space that's going to make a difference. So, congratulations, Tyler, Texas, on making an incredible choice and a decision to offer the just right support. So, this absolute sapphire gem, boy, can she shine.
Oh, thank you. Thank you so much, Deepa. That's so
You
sweet.
are so welcome. It's such a pleasure.
Thank
All right,
you.
everybody, look for somebody like her. Oh, I'm not sure you'll find her, but keep looking. And she's working on that white paper.
Thank
Good
you.
thing.